Welcome to our town hall, everybody. I want to say thanks, first of all, to our sponsor, Crunchmaster. This event is possible thanks to them. And I want to introduce Dr. Jordan Dubow and Dr. Iain Croall for this month's town hall webinar. Super, super grateful to both of you for being here today to discuss the brain and the gut-brain connection and all things your brain on gluten. May is Celiac Awareness Month, as you probably know, and May is also Mental Health Awareness Month. And so we wanted to combine both of those two wonderful topics for this town hall. So I'll pass it over to Jordan to introduce himself, and then we'll move over to Iain, and then we can start on Iain discussing some of his research. Jordan, take it away.
Thanks, Lauren. Really appreciate the introduction. Thanks, everyone, for joining us today. We're really excited to be talking about celiac disease and its connection to the brain. I'm a neurologist by training, and so this has importance to me. I'm also the chief medical officer at Beyond Celiac. As many of you who've listened to these podcasts before that I've been on know that I also have a almost a 14-year-old child who has celiac disease. So I've been, I understand that and, very concerned about overall celiac health as well as their neurological manifestations. So we're really excited today to let Dr. Kroll give some of his research highlights, and then we're going to go over some questions. So with that, I'll pass it to Dr. Kroll.
All right, thanks very much, Jordan. Thanks very much to anyone who's listening and to Beyond Celiac for inviting me today. So my name's Dr. Iain Croall. Not a clinical doctor, doctor by PhD. My background is pretty strictly in sort of neurological health. So my PhD was actually in traumatic brain injury, and I've spent some time as a postdoctoral researcher in sort of the field of dementia as well. But since 2017, best part of a decade now, I've been at the University of Sheffield in the UK, which is a real kind of leading centre for research into celiac disease very broadly, but also quite specifically celiac disease and how it can affect the brain as well. So I've been invited at the start of this session to give a kind of like a quarter of an hour sort of quick overview of the topic, and as we've said, sort of highlights of research that I've been involved in as well. So I'm going to lead with doing this. Um, I think when you talk about celiac disease in the brain, many people, certainly in the general public, maybe not quite so much if you're listening to this, but it's to obviously ask the question, well, is the brain affected in celiac disease? It seems almost like an odd question to ask. But to address that up front, the answer is definitely yes. And I'm going to talk about this in more depth. So a little while ago, as a kind of place to start, I went and looked back through all the medical literature to try and find the first sort of reported mention of celiac disease possibly affecting the brain. And back in the olden days, as it were, celiac disease was known as sprue when it wasn't very well understood what it was or how it was working. And there's a couple of reports from the early 1900s of patients with sprue who go on to have problems with sort of balance and coordination, movement, and also sort of sensory issues as well. They might have like a lack of sensation or sort of painful sensations, pins and needles, and things like this. And this matches very closely with what we would call today, on the movement and balance side, something called ataxia. So if patients have got ataxia, ataxia can have many causes, but generally speaking, a patient with ataxia has problems with balance and coordination. And on the sensation side, something that we call neuropathy. So again, neuropathy can have many different causes, but if a patient has neuropathy, they would tend to have issues with sort of sensation, maybe in their extremities and things like this. So these days, uh, gluten ataxia and gluten neuropathy are sort of bona fide, well characterized, and maybe not the best understood, but there's ongoing research into these conditions. So that is when patients develop either ataxia or neuropathy as part of either celiac disease or more broadly still kind of an autoimmune reaction to gluten that doesn't necessarily have to involve celiac disease, but still driven by gluten and the body's immune response to that. And if you go and look in the literature, in all the medical studies, if you sort of type in celiac disease and neurological problems or something like that, probably the first things you'll come across is this idea that in kind of rare cases, a patient with celiac disease further down the line may go on to experience noticeable problems with their balance and coordination and things like this. So I think two of the major questions that come out of this that I want to address are how common is this when somebody actually develops ataxia or neuropathy or that type of thing? And if we kind of put that to one side and go, well, that probably is quite unusual. If as somebody with celiac disease, I don't go on to experience, kind of progressive loss of movement and all these quite scary sounding things, does that mean that I've kind of got off scot-free? In kind of regular celiac disease, as it were, is the brain affected at all, or is this just quite this kind of unusual thing? There is a third question as well that I think is always on everyone's minds as well, which I will come back to later. So that first question, how common is this to develop ataxia and neuropathy, is kind of difficult to say. There's a review that was published in 2019 that looked across all the different published studies up to that point that somehow or other estimated in people who have celiac disease, how often do people go on to get ataxia? And that ranged from 0% to 6%. And how often do people go on to get neuropathy? And that ranged from 0% actually to 39%, which sounds quite high. But of course, we're seeing this quite strong sort of variability, and clearly there's plenty of publications and reports out there that come out saying very low that there are no patients who go on to develop ataxia or neuropathy. I think the issue here, and this is what drives a lot of the kind of what confusion and controversy there has been in the subject area, is trying to discriminate between when somebody develops quite an obvious, severe problem, that if you go to a GP or, kind of like a non-specialist doctor, they would look at somebody and say, oh, you are suffering from a neurological issue, we need to refer you to the neurologist. And people who in themselves recognize that something is wrong, that they're not quite functioning where they were before, but who, if you go to a non-specialist doctor, might be looked at and gone, well, you're still in the band of what we'd call normal. This band of normal, I think, is a problem almost that comes up quite a lot, because normal is still a spectrum. You can be a very healthy normal or you can be a less healthy normal, but often to many doctors be sort of looked at and be said, well, we can't really tell the difference here with the tests that we have available to us. So I think if we apply that to this question and go, well, do people with celiac disease still suffer some level of problem, even if they don't wind up getting referred to a neurologist and being diagnosed with something like ataxia? There's lots of studies out there that say yes. So when I joined Sheffield and I was first sort of getting my head into this field, it's not too difficult to find that there are studies showing that patients with celiac disease, on average, will have poorer cognitive performance compared to controls. They might be a bit slower to complete certain tasks and things like this, even once they've gone on the diet, although the diet does seem to also help, kind of recover some function as well. And there's other studies as well. I think it's quite well recognized that celiac disease comes with higher rates of depression and mood problems too. There was, not to bring something that sounds too sort of alarmist into this, but there was one quite large study done, I think, with Swedish healthcare data that looked at thousands and thousands of healthcare records and found that on average, celiac disease has got a higher risk further down the line of people developing a type of dementia called vascular dementia, which can have multiple different causes. But apparently, this has got a slightly increased risk if you have celiac disease. A study which we published that I was involved in 2019, we wanted to try and better characterize exactly this question: how often do people with regular celiac disease seem to have issues with neurological problems if looked at properly by a neurologist and if asked the question themselves? So we went to our gastroenterology department, so the patients coming through the door getting diagnosed with celiac disease in the regular way, as it were. And we recruited 100 patients at the point of their diagnosis, so they could not be recruited sooner as somebody with celiac disease. And first of all, they were asked, would you say yourself you have any issues with X, Y, and Z? And we found that a quarter of the group reported balance issues to some degree or other. We found that about 10% reported sensory problems to some degree or other, and 42% reported having frequent headaches, migraine type headaches. And this is something that's very, very well recognized in the literature of migraine being related to celiac disease. And we also found that when they were examined by a neurologist, 10% did have some evidence of neuropathy. 11% had something called nystagmus, which is where there's kind of like an eye movement problem. It's sort of induced in a certain way that the eye will sort of twitch abnormally, which is what they call a neurological sign. And we found that 30% had some level of difficulty walking. And all of this could be summarized to say that if you excluded headaches, we found that half of the group exactly had some sign or symptom of neurological dysfunction. So I think that's a very good starting point to get a feel for when asked or when looked at by a specialist. Yes, we do find that things happen, and they're quite common, really, in patients with what you would call regular celiac disease. And that's, of course, not to say that the gastroenterologists who see people with celiac disease aren't excellent at what they do. I think it's just an inevitable complication of your primary doctor in that case being a specialist in what goes on in the gut. And so if you're presenting with neurological things, they're not going to be picked up as quickly or as cleanly. It's not necessarily anybody's fault. It's just kind of the way that it's going to fall. But increasing awareness of this is, of course, very important and something that we're very keen on doing. Another study I wanted to highlight, some of the criticism that can be leveled at this field of research is that the research groups, such as the one that I'm a part of, but others as well, who run these papers who find that there are issues with celiac disease and the brain, often tend to be quite specialist. So the neurologist who's examining these patients is really kind of really keen and quick to pick up on things, perhaps. Or maybe the patients who come through because their specialist centres aren't that representative of general population of people with celiac disease. So to address this, we did another study where we got access to population healthcare data in the UK. There's a big resource in the UK called the UK Biobank, and initially the UK Biobank obtained and recruited 500,000 adults in the UK, asked all sorts of questions about their healthcare background, their medical history. And in a lot of these participants as well, they underwent brain scanning, some cognitive testing, and completed questionnaires, which included things about their mood. So we got access to this data because, of course, this data is sort of true population data. It's nothing to do with our centre. There's no kind of biases that exist there. And we went into this data and we found all the patients we could who had celiac disease and who were free of other neurological problems, so kind of just celiac disease, as it were. And we matched them to controls who did not have celiac disease on age and sex and hypertension and all these other things that could affect the brain and be things that you'd want to control for in a study. We found that the people with celiac disease, on average, did have slower reaction time on a cognitive test. They more often reported symptoms of depression and other mood problems, and we found on their brain imaging that there was evidence of physical changes in the brain in and around the regions that would be implicated in, say, ataxia, so sort of the cerebellum and the thalamus, and sort of development of movement problems as well. So I think to kind of summarize all of this, my general position is that severe diagnosable neurological problems are relatively rare. I think there's no getting around that sort of full-blown gluten ataxia is quite an unusual complication of celiac disease, but we do commonly see that celiac disease has some degree of injury to the brain. That will affect people in ways that they know themselves are going on and which are measurable and detectable if looked at properly and by the right people. But I think when you go to, your doctor with it, that's not the best context for this always to be recognized in and sort of dealt with. Uh, the third question is, how do we treat this? And obviously, it's always on everyone's minds, is the gluten-free diet good for this? And the answer to that question is yes. The evidence that we have, including a number of studies that our group have done as well, show that when patients who have neurological things going on go on a strict gluten-free diet, we do see that there is some degree of recovery of neurological function, usually. Certainly, it seems to stop further progression of anything getting worse than it already is. I think there's an ongoing question and concern, though, that the level of dietary strictness that you might need to go on is very, very high to achieve this. There's a few kind of papers where the implications going on there is that if you have celiac disease and you're on a strict enough gluten-free diet that means that you're not really suffering from gut problems anymore, that's not necessarily strict enough for your body to be in an unreactive state to gluten if looked at with blood tests. And this is what we think might need to be achieved in order to be protective of the brain. So this brings me on to the very last thing I'm going to talk about quickly before we get on to questions, which I know we've got. But Beyond Celiac have very kindly been supportive of a study which wrapped up quite recently at the University of Sheffield, and are also supporting a different new study that we're doing as well, which looks much more closely at these sorts of questions. So there's a new blood test which looks for a gluten antibody called TG6. This is not the same blood test that you may be familiar with to test if somebody has celiac disease, but we think that somewhere between 40 to 50% of people with regular celiac disease also make TG6 antibodies. So it's kind of a half and half thing. And evidence that we've got so far kind of indicates that if you are somebody who makes TG6 antibodies, that might be an indication that you're someone who's relatively more at risk of going on to have neurological complications further down the line. So we think this might be this kind of very important blood test to kind of better direct care and to find people who maybe need to be more strict with their diets, and maybe even use it as feedback in subsequent clinical appointments to find out, has your body become unreactive to gluten now? Has the test for this become negative? We think that might be a more objective way of finding out if someone's being successful with their treatment than, for example, just seeing if their gut symptoms seem to be better or if they've resolved. So the study that's very recently wrapped up with Beyond Celiac, we looked at, in our specialist neurological centre, at patients with diagnosed gluten ataxia, gluten neuropathy, these sorts of things. And we found that the more history that these patients had of TG6, because these patients, we have access to this test in Sheffield, and these patients get regularly tested for it. So the more frequently people tested positive for TG6, the more people failed to have eliminated it from their blood through diet, the more severe neurological disease they seem to be presenting with. And that was true with respect to kind of the rate of brain atrophy. It was true with how depressed they were reporting themselves to be and how severe their physical symptoms were. And the new study that we have running, which is very exciting as well, is now looking at the gastroenterology department. We're going back to this idea of looking at patients with newly diagnosed celiac disease, regular celiac disease, as it were. We're kind of reconfirming with this, the current version of the kit we have, how often these patients do test positive for it, but then we're going much further and we're looking at how that might relate to their mood, to their cognitive function, and we're also following these people up over time to see how often these patients become negative for TG6 over time if they were positive at first. So I think this is all very kind of exciting area of research that we're really trying to dig more into these questions about neurological symptoms, neurological health, and really trying to fine tune the way that we treat and care for patients as well. So I think that's been my 15 minutes. It's possibly been 16 minutes, but I will stop talking now. I hope that's been interesting to people listening, and I'll hand back over to the panel because I think we're going to move on to some questions now. Thank you very much.
Yeah, and before we start, thanks, Dr. Croall, for a wonderful summary of it. I just want to put a couple clinical context, and then we'll get into questions. And I think the work that Dr. Croall is doing is incredibly important, and so that's why obviously we're trying to fund that up Beyond Celiac and to continue to learn about the neurological manifestations. A couple important things, though, as everyone's listening, and not to scare people of neurological manifestations. Clearly, as Dr. Croall said, they're prevalent, right? And then the issue is sometimes people have acute symptoms. We have some questions we'll get into about when they get exposed. And actually, we recently had a poster at the American Academy of Neurology meetings, right? A celiac poster at a neurology meeting talking about the prevalence of data surveyed from our community when they think they've been exposed, what kind of symptoms did they get? And so that's important. And then what Dr. Croall is referring to as well is kind of chronic over time. What are long-term risks of sequelae, related to that, whether that be neuropathy, ataxia? And so I think as we think, as you family members think about it, there could both be acute manifestations as well as kind of long-term. One of the challenges, and this is something I'm really interested in, clinical trials right now, we're not really looking at kind of drug effects on these things. How many people have them after gluten exposure? What do you get? And so clearly there's a lot of research that's needed. And even the work that Dr. Croall and everyone has done, people should also be aware, just because there's an association doesn't always mean there's a causation, right? So someone with celiac may have an increased risk of X, doesn't necessarily mean the celiac caused it. And so that's why we do need to continue to do all this research to truly better understand, to continue to follow people, to collect data. Because I know when we, talk to people, I see it, and those of you in this community, we know neurological manifestations are prevalent, and sometimes I think they're underscored. I think sometimes they're minimized, and also some of these things are common in the general population. So that's what we're trying to figure out, is kind of what is the risk. And obviously, as Dr. Croall said, the gluten-free diet, we know data shows it does help. As he said, it may not be enough. And so there could be benefits of treatment, even if you're not having GI symptoms. Who knows? Maybe a treatment could actually help you long-term, for neurological manifestations. And so there's just so much that we need to learn. Thank goodness for, Dr. Croall, his work he's done for a long, long time trying to answer these questions. But the important thing is we need to continue to study these things and help answer questions both for acute and long-term brain health. I think with that, we'll move on to some questions.
Thank you both so much. That was so fascinating. And it's one of those things where it gives me, it's a little bit scary, certainly, to like hear these things, but I think that it's so wonderful to hear that research is being done, and there is hope that we will continue to understand the other symptoms of celiac that are not just gastrointestinal, because we know that obviously there are a lot. So I'm kind of curious if you both could discuss the gut-brain connection at large a little bit, and why some of these neurological symptoms might be happening. Like, how does our gut and our brain connect to each other? Why do they talk to each other so much? Why is that so related? And particularly with celiac disease, but also just in general, like, what's the connection there?
I feel I've already talked quite a lot. Would you like to jump in first on this, Jordan?
Yeah, sure, Dr. Croall. I can give my input, and then we'll let you add to it. So I think the funny thing is the gut-brain connection is very clear, right? Again, I'm a neurologist. I deal with neurological diseases, and even some neurodegenerative diseases like Parkinson's disease. There's evidence that it actually could start with kind of the abnormal proteins in the gut that can get to the brain. So clearly there is a connection with the gut and the brain. And one thing that I want to better study, because I don't think we know the answer, and I'll let Dr. Croall elaborate, is what exactly is the cause? I don't think we know, right? When someone gets exposed to gluten, we get an immune reaction. One question is the immune reaction itself getting into the brain, right? The brain's kind of protected by a blood-brain barrier. There's fluid around the brain. Is the immune response actually getting to the brain? And that's what's amazing about the work Dr. Kroll's doing with this kind of TG6, right? Is this antibody maybe getting into the brain? You're used to TG2 when you're kind of looking at how you're doing. Or alternatively, is there some immune or irritation that's just going on in the enteric, kind of the nervous system in the gut that's causing the symptoms in the brain, right? And so my view is like, I don't think we know, Dr. Croall, right, what exactly it is. I think that's an important question that we really need to prospectively study to know, is the immune reaction truly getting in the brain? Which my guess is there's probably yes. I mean, right, it's a systemic immune reaction. Or alternatively, is it just the immune system in the gut kind of irritating the enteric nervous system, that nervous system in the gut, that then causes symptoms in the brain? And it could be both.
Yeah, I mean, I agree entirely with everything said there. So when I've been talking about TG6, this is a kind of like a very current point. We do these blood tests, and that's looking for an antibody, that's in somebody's bloodstream. And it's inevitably a question of going, is that antibody somehow getting into the brain and causing some reaction to brain tissue that's then harming the brain in a very direct cause and effect way? Or is it what we'd call in research and clinical science just a marker of people who otherwise are more at risk of things which are going on with their brain too. And we don't have the answer to that question at the moment. There's kind of definitely maybe is the answer to both angles on that. There are some lab-based studies that show it may have the potential to do this. Whether it can or would cross the blood-brain barrier is a question. The kind of the whole gut-brain axis thing is often quite defined by this very broad idea of leaky gut, leaky brain, which we know, for example, in celiac disease, you have increased intestinal permeability, so things can kind of pass through that into your bloodstream that maybe shouldn't be able to, and maybe this in the same way can go on to cause your blood-brain barrier to be leakier than it should be as well. But it's really difficult to pin this stuff down, and you need very kind of targeted prospective studies, as Jordan said there, to really dig into that. Yeah, it's a big area for future research. I think at the moment, when we talk a lot about TG6, I think it's very interesting in its possible role of finding the people who we need to be looking at more in clinical situations, and patients who need to be given more advice, more time and attention, maybe as a monitoring tool over time to kind of, to see again if the bodies appear to be becoming unreactive and kind of calming down in that way. Whether that's the thing that's actually causing the injury, we're not sure.
And then, Dr. Croall, let me ask you this question, because I know we've talked about this. We know there's a lot of clinical trials going on with drugs, and as part of that, the good and bad of the field is sometimes we do have to give gluten challenges to see if a drug worked. And I mean, I would think as part of a gluten challenge, at least acutely, doesn't tell you the chronically. We've talked about this. I think it would be possible. Again, someone had the money, someone's willing to do it. There's some imaging we potentially could do, and I'd like your opinion, like PET imaging. Or there's also ways we can actually sample the cerebral spinal fluid. It's not ideal, but you can do a lumbar tap to actually look for antibodies. And so as much as, again, these are things I think, again, the community, we can try doing. Again, someone needs to want to do it. We need the funding. But would you agree, Dr. Croall, that like we probably could, as part of a gluten challenge, look at some of these things, at least acutely? Maybe it'll be harder for chronic, but I think we could look at brain imaging. We could look at the antibody that you talked about. I imagine we could check it in the cerebral spinal fluid, which could be indicative of it's actually in the brain.
Yeah, absolutely. There's a lot of the imaging that we can do. You mentioned PET. There's something which we use in the clinic a lot, which is called magnetic resonance spectroscopy as well. So brain imaging, I think we often just imagine, oh, you get a black and white picture of a brain, and you can maybe see that something is wrong with it if you look at it with the right sort of expert eyes. But there's an awful lot more you can do with neuroimaging as well. So this thing called MR spectroscopy is used a lot in patients with these conditions. And what that does is it tells you the concentration of different chemicals in the brain. And if they have gone up or if they've gone down, these are things which can change in quite a short term sort of sense, kind of days to a week or so in response to something. And we know that one of these, something called N-acetyl aspartate, is a very sensitive kind of indication. The more of it you have, the better, essentially. And patients will come in and we'll kind of using the MR scanner will sample how much of this somebody has in their cerebellum, at the part of the brain that's mostly to do with ataxia. And we'll very reliably see that it will be decreased in patients compared to where it should be, but that when I'm talking about evidence that when people go on a gluten-free diet, that this is helpful, we see that when patients do go on a gluten-free diet, and particularly when that gluten-free diet results in they're getting rid of their gluten antibodies, when you repeat that blood test, that the level of this has jumped up again. So that kind of indicates the level of brain function recovery. So there's all sorts of things we can do. I believe our group has actually just published a paper. I'm not involved in this arm of the research, but some of my colleagues do lots of wet lab work with these kind of CSF studies, and kind of looking at things in the lab, as it were. I believe we have actually just published a paper which has shown that IgA TG6 antibodies are found in the CSF of a patient with gluten ataxia who we obtained a sample from, which was a very recent publication. So I think, again, we have these indications that the antibody itself is around there. It could well plausibly be the thing that's driving some of this harm. But yeah, we're kind of getting closer and closer to this all the time, and certainly the right study could be set up to really try and definitively answer that question.
Great. Thank you so much. Great. Thank you for answering the questions. We have a couple of questions in the chat, and one of them is from Melissa. And Melissa's wondering if the age of development or diagnosis of celiac, does that affect the extent of the brain injury? It sounds like likely yes, if a patient with celiac continued to eat gluten, that potentially that could lead to further damage. This sounds like maybe another reason for early screening and early diagnosis, but I'm curious your thoughts on that.
I think generally speaking, what we would expect is that assuming that if we're talking within the sphere of people already being an adult, that it's the length of time somebody has had the condition for without it being diagnosed that's the main sort of determining factor in it's kind of how long somebody's had the condition unchecked. And it's actually a real point of interest that it's not something I really went into, but another angle of all this, which is really important, are patients who don't necessarily have celiac disease, because the definition of celiac disease is the gut problems. It's the pathology that we find in the gut. So if you don't have that pathology, then you don't have celiac disease. But that doesn't necessarily mean that you may not be experiencing ataxia or neuropathy due to an autoimmune reaction to gluten. So a lot of the patients we see in our specialist clinic wind up being diagnosed with this through blood tests like TG6, and then kind of observing their clinical response to the diet and a combination of these things, don't have celiac disease. And we find that the average age of those patients is without celiac disease is about a decade older than patients get diagnosed with celiac disease at. So it's a bit of a pet theory to wonder if, because we're relatively, I know we can always do better, we're relatively more accomplished at diagnosing someone with celiac disease if they have gut problems. So maybe that's something which we're good at picking up on kind of quickly. If somebody doesn't have those gut symptoms, and they have this unchecked disease for longer, maybe they've developed that autoimmune problem around the same time in their life, but it's expressing itself through kind of grinding on the brain rather than in the gut. That goes on for longer before it gets picked up, and so that we see until they have neurological issues, which are quite obvious to wind them up at the neurology department, and then the age of diagnosis becomes kind of 55 rather than 45 in adults at that point. Um, yeah, so just a point of interest on that, I suppose.
Yeah, thank you. That's really interesting. I'm curious, somebody asked or submitted a question ahead of time, asking about what steps you could take to get the best treatment if you have neurological symptoms, perhaps more than gastrointestinal symptoms. And somebody else asked why neurologists are not as aware of celiac disease as they perhaps should be. Obviously, this is a relatively new field of research, and so certainly there's that. But I'm kind of combining those questions. I'm wondering what someone with neurological symptoms could do. Would going to a neurologist be the move? Would going to a gastroenterologist to, pursue a celiac diagnosis be the move? What do you both think about that?
Yeah, so I can start. So I think that's part of the reason we did want to actually present celiac data at a neurology conference to start the awareness that they're connected. Because yeah, I do think it's something that neurologists aren't as aware about. Some of the symptoms can either be part of celiac disease or gluten can make someone with migraine worse if they have celiac disease. Then the flip side, the gastroenterologists, I think, are generally more focused on the GI symptoms, and not that they ignore the neurological manifestations, but probably that is their focus. And so I think, as we said, there's a couple ways of looking at it. Kind of the acute symptoms. People say, yeah, when I get exposed, I get brain fog. And I think someone had a question about that ahead of time as well, which is kind of just difficulty concentrating, kind of cognitive slowness, just trouble thinking is kind of what brain fog is. Or my migraines get worse. And so I think anytime you have a neurological complication, definitely bring it up to either your gastroenterologist, your primary care physician. Just like having headaches with or without celiac disease, if it's bad enough where it impairs your daily function, it is probably useful to go see a specialist, see a neurologist, because again, if you have celiac and migraine, data has shown that the gluten-free diet can help the migraine. Doesn't mean you don't have any other triggers of migraine, so you still obviously may need medical treatment of the migraine. And then obviously other things that I'd say are more serious, as Dr. Croall mentioned, things like clumsiness or ataxia where you're fumbling, having trouble walking, you can't, your arms aren't working as well, or neuropathy, consistent tingling, numbness, that 100% you should let your doctor know, potentially see a neurologist, because just like celiac disease, there are a lot of other causes of those things too, right? Sometimes it is nutritional deficiencies that can cause a neuropathy or an ataxia, which obviously could be related to celiac disease if it's not as well controlled, or it could be related to something else. Or things like diabetes can cause neuropathy. And we unfortunately know, diabetes, at least autoimmune type 1, we see some of these autoimmune diseases traveling together. And so I think regardless, yes, bring it up to a physician, because again, it could just be, unrelated to your celiac disease. And a lot of these things are common, could be related to the gluten-free diet, maybe not being as well controlled, more inadvertent exposure. Whereas, Dr. Croall said, it is possible there's just still some kind of smoldering underlying inflammatory process that even without gluten, that still is causing symptoms that, may need to be treated another way. And so I think don't be shy. Don't be afraid to bring these up with either a gastroenterologist. Never, and if symptoms are debilitating, without a doubt, to get referred or go see a neurologist, A, to ensure there's nothing else going on, but B, to get the diagnosis, be examined. And then really it should be the team working together to strict gluten-free diet. Are there other things we need to do? Clearly migraines we can treat with medicines. If someone does have neuropathy, there are medicines we can do to help reduce that type of pain. But 100%, don't be quiet and speak to your physician.
I don't really think I've got too much to add to that. Except to say, I think some of what lands on our side that we need to also be continuing to push and be aware of is that, I think it's safe to say that for a long time, this has been a relatively kind of controversial topic. I think, we experience, even as researchers and clinicians, and I'm sure many patients will be, sympathetic to this too, some skepticism about, oh, is it really suited to gluten and all this kind of stuff. There are some excellent neurologists out there, present company included, and one of my senior colleagues who I mentioned briefly, Professor Hajivasulu, has been also kind of pioneering in this respect, and it is great too. I think it's still something that needs greater awareness within the medical community and a greater kind of push. Of course, that's something where the responsibility lies on us as the medical researchers to continue to do good studies, publish good data, present these things at different conferences, and, get the word out among the medical community that this is something which needs to be considered. And then that inevitably will feed back to and benefit the patients as well.
Thanks so much. Somebody asked how you can distinguish between celiac symptoms and general anxiety, depression, sadness that, in their words, could affect anyone. I'm curious about this as well with the social components of celiac. It's kind of a separate topic here, but obviously having to be on the gluten-free diet and interact with the world in that manner, there's certainly some struggles there as well. What are your thoughts on that? How much of this is social? How much of this is, direct gut-brain connection? Is that a question worth asking? You know what I mean? Like, what's the thought?
And I think I don't know, Dr. Ross, I think it's similar to the first question. I think, the reality is it's likely all of them, right? And so we know that being on a gluten-free diet, I see there's some isolation, being different. It's just, always need to let people publicly know, your server, I can't have gluten. And so clearly there's underlying, not related to the disease itself. I think there clearly is associations, at least associations with higher rates of, anxiety. How could you not be anxious of, again, our fear of eating, of making you sick? Depressive symptoms are more common. And from data we've collected, again, it's observational data that, again, our community has provided us with surveys. When people think, at least they're pretty confident they've been exposed to gluten, fatigue is the highest symptom we see, but this brain fog is very high. Headaches are very high, but feeling acutely anxious or having a depressed mood is actually very, very common. And so I think there's very good reason to believe that it probably is underlying to the disease because of the exposure itself, which hopefully we can continue to do more studies to help better define that. But also I think is just part of the disease, because people have celiac disease. I think there is a higher association of some of these things. So I think it is hard to wrap the two around, but my view is it's really both based on the data we have. And obviously, until we continue to do studies that Dr. Croall mentioned before, where really you do expose someone, you kind of see acute reactions that is some immune response. I think it's hard to separate the two, but clearly it happens. And right, I think that's again the importance of, as Dr. Croall said, not minimizing this, not thinking, oh, like no, like it's prevalent. And the reality is right now, regardless, obviously the gluten-free diet is the only treatment we have today. Obviously, we're working towards treatments, but then ensuring if there is underlying psychological anxiety, depression, we also have good treatments for that. There's people to talk to, and so I think yes, we want to understand the exact association, probably both, but regardless, it's important. It should be heard, and it can be treated.
Yeah, as said, I think it's a double whammy. Of course, living with a chronic condition that affects your social life as well as your physical health, I think it's inevitable that all else being equal, that would lead to some issues with mood and depression and things like this as well. But we know too that there are very physical things that happen in the brain when somebody becomes depressed or anxious. And you can prove this in various different ways. These can be quite physical conditions as well. So, and given that we know how the brain can be affected in celiac disease, I think, and this idea of kind of a general level of kind of inflammation throughout the body, and it puts everything under heightened stress. And there's quite good evidence that this, in all sorts of different contexts, celiac disease or other comparable things, can lead to increased levels of depression as well. I think it's inevitable that it will have that kind of physical aspect to it as well. And there are things, I mean, one of the things I think is quite interesting is that the levels of GABA in the brain have been sort of linked to depressive symptoms. This is something that recently we've been able to try and we can kind of image again. I mean, I always bring everything back to brain imaging. That's my own bias. But this is one of the things that we can do in a research study is that you can try and look for the levels of GABA in people. So I think that's something that'd be really interesting to do as well. In patients as a way to try to start to disentangle how much of it is kind of like social, rational response to a more difficult condition in your life, and how much of it might have a physical kind of component running underneath it as well. So these are all things that I think we really want to look at.
Would you explain the GABA stuff a little bit more, what you mean by that and what role that plays?
So this is not something that I'm too expert in. I don't want to jump into it too much, but there's kind of what we call the GABAergic sort of theory of depression. So, GABA is one of these chemicals in the brain, and I think there's various indications that if the levels of it kind of become dysfunctional for some reason or other, then the brain function accordingly doesn't work as well as it should. And this seems to be in people who have like major depressive disorder, quite a reliable finding. So I think something like that should be, I think, a very interesting target for kind of future research studies to look at to kind of get a grip on the physical function aspects of depression.
That's super interesting. Speaking of chemicals in the brain, Deborah asked about how serotonin functions in the gut and how that's connected to the brain. If you could maybe explain that a little bit to our patients.
Yes.
I mean, do you want to take that?
No, by all means, I'll go for it.
I mean, this is another one. We don't know the exact reason. I think a lot of this comes from kind of even irritable bowel syndrome and whatnot. There are, because serotonin itself can cause, diarrhea, right? When people go on antidepressant drugs, again, right now, it also increasing serotonin, helps with that. And so serotonin clearly has a connection with kind of nervous system, the gut at least causing diarrhea. And we know with irritable bowel syndrome, serotonin is important because there's actually drugs that block serotonin. And also on the flip side, the challenge is that there's sometimes for irritable bowel syndrome, sometimes SSRI, serotonin reuptake inhibitors, can actually improve it. And so serotonin's still, connected. I think it's unclear yet the connection to serotonin, the enteric nervous system, to how that then affects kind of brain health. I think it's just right now, at least to my knowledge, I think it's still kind of unknown. We know serotonin is important in the gut. We know serotonin is important in the brain, as there are a lot of different medicines that both kind of act like serotonin or block serotonin that can affect things from mood, some other psychiatric diseases like, some of the psychosis or schizophrenia. Serotonin's involved. So we clearly know serotonin is involved. I think with celiac disease, I'm unclear of kind of the exact role, though. I don't think we have the exact connection, but I'll defer to Dr. Croall if he has anything else to
No,
add to that.
it's a really interesting question, and this was one of the ones that we got sent in advance. And I tried to do a quick little look, and I was not able to find much research at all looking at serotonin in celiac disease. Uh, so of course, I think as much as the general public might know about serotonin, I suspect it's mainly in the context of things like depression, because as Jordan said, you have this class of antidepressant drug called SSRI, selective serotonin reuptake inhibitors, and very kind of broadly speaking, these boost levels of serotonin in the brain, and this appears to help with mood. But it's the majority of serotonin in the body is in the gut, and the way that serotonin works in the gut in the immediate direct sense isn't necessarily anything to do with mood at all. It's a neurotransmitter. It stimulates other things to happen. It can cause people to, it controls how nauseous people might feel. I think it has functions to do with your gut moving food along, gut motility, things like this as well. I think some indications that it has roles in the immune system and the immune response as well. So the serotonin in the gut is not the same. I mean, I think molecularly it is the same as serotonin in the brain, but these are should be two separate closed systems because the serotonin outside of the brain should not be crossing into the brain. But products of serotonin or things that serotonin in the body have done might cross into the brain. So if you have a serotonin upset or dysregulation outside of your brain, that could still have a knock-on effect. It's a big can of worms, I think. There's lots of different ways that kind of question can go, and certainly we don't know enough, particularly as specifically with respect to celiac disease. I think this hasn't really been looked at very much in the past, but it's absolutely a really interesting question.
Sounds like such an interesting developing field. It's very cool to be witnessing this. I do see that somebody has a raised hand, and if you want to pop your question in the Q&A section in the Zoom, please feel free. Another question we got ahead of time from Angela is, I've read studies of increased incidence of epilepsy, excuse me, as well as abnormal EEGs in people with celiac, which usually resolves on a gluten-free diet. What is your take on this?
I mean, you want to say that, or I can start. I mean, I think,
Yeah.
again, these are associations, right? So we
Yeah.
know people with epilepsy do have a higher association with celiac disease. With celiac disease, at least kind of studies that have looked at lots of studies combined, not a lot of data, the risk of epilepsy is a little bit higher, right? And we also have to think there's something called kind of the relative risk versus the absolute risk. And so we're talking about the relative risk, meaning how likely are you to get it. So even if that risk is a little bit higher. I think it's 1.3, 1.4. And let's just say 10% get it. That would mean 13% with celiac. So there's still the difference absolutely is small. The relative is a little bit higher. And so I think there is some association. There are case reports out there for people who have kind of what we call intractable epilepsy, epilepsy that you can't kind of control. If you actually go on a gluten-free diet, it could be beneficial. But at least to my knowledge, I don't think it still is exactly clear. I don't think we exactly know why that is. I mean, there's other epilepsies that you do kind of go on a certain type of diet related to kind of what gets in the brain that can help. So it's possible. But I still think it's really unclear. Just because you have celiac disease, again, my take, I wouldn't be worried that you're going to have seizures. People with epilepsy, again, seem to have even a higher risk of celiac disease, but I don't think we know the exact reason. And I don't think it's 100% clear, though, that, what that risk is. I think on the flip side, if someone has seizures that you can't control, it might be reasonable to try a gluten-free diet because sometimes when seizures are so bad, people are on multiple medications. But if you have celiac disease and don't have seizures and you're on a gluten-free diet, I think my clinical take is I would be concerned that you're going to get seizures.
Yeah, this was something else that I was sort of double checking with the question in advance, and as said, the relative risk is there, it's detectable. So I think it is the two kind of are a bit more common with respect to one another, but this is a relatively small kind of thing, and I think because the risk certainly in celiac disease is already undoubtedly kind of quite low to begin with, that relative risk doesn't become very high. We don't know why. Very broadly, you would hypothesize that because we know celiac disease can affect the brain, that in certain cases you may be more likely to have the brain affected in such a way that makes epilepsy then more likely to occur. But how that happens, if it's direct, if it's this kind of broader indirect association, all of that kind of stuff just really is not known at the moment.
We've got a question in the chat about a connection between celiac and MS as well, and I'm thinking it's probably a similar answer. Like potentially yes, but many factors
Yeah.
there.
I mean, autoimmune diseases, unfortunately, tend to travel together. So autoimmune
Right.
Yeah.
thyroid disease, diabetes, celiac disease, some of these are getting more common when you look at those things together. And again, I know Dr. Kroll, I mean, I'm not aware
Mm.
though of truly the connection between, I mean, MS, right? There's theoretically, you develop antibodies, what are called auto antibodies to kind of, kind of the nerve sheath that kind of, helps how signals travel. And so, there really shouldn't be necessarily a connection because celiac disease is a little bit different, interestingly, than most normal autoimmune disease because you develop a reaction to something external as opposed to MS. We think it's, something,
Mm.
that your body somehow didn't get rid of, very early on. And so that's another one where, again, if you have celiac, I wouldn't be worried about you're going to get MS. I think it's likely probably some just associations where, unfortunately, if you have one autoimmune condition, you're just more likely to have another. And the actual underlying disease of celiac disease likely doesn't cause the other one. It's likely that they're just associated. If you have one, you just have a higher chance of having another.
I don't think I really have anything to add to that. It's yeah.
That's great. Someone in the chat also wanted to clarify that the recent studies that we were talking about before were only done with adults, correct? There has not been any neurological studies with children thus far.
Not really. There's very little. It's not that there's literally none, but they tend to be more kind of case reports or with very, very low numbers of kids in the studies. So yeah, pretty much all of the research that's been discussed. I mean, I think all the research that has been discussed has been in adults. Pretty much all the research that's out there is in adults. We've actually been recently trying to get off the ground because we at Sheffield, we have a children's hospital kind of across the road that has a specialist ataxia centre, and I think there's something like 30 kids there with gluten ataxia. So we're trying to, and they all get quite high quality brain imaging done and these sorts of things. So we're trying to explore actually to dig into this more because it is very much an untapped area of research and obviously of great importance as well.
But I think right now, and again, Dr. Tell me if you feel differently. I think still thinking about kids right now, at least some associations that we know of, there are things like ADHD, right? So there's some evidence that that seems to be higher, and celiac disease might get better in a gluten-free diet. Granted, it's a pretty common condition in children now. Otherwise, I think when you think of the adolescents, the teenage population, some of the psychiatric comorbidities we've talked about are things to be aware of, right? So mood, anxiety. Again, is it being exposed to gluten intermittently? Is it just part of the disease, or is it because of the consequences of the disease? We don't really know, but I think those things are common, and also headaches, right? So again, migraine is
Mm.
common in kids, and unfortunately, it's everyone who has migraines in the onset. We don't screen for celiac. It's a separate debate. Should we be screening more for celiac besides from people who have nutritional issues or, impaired growth? I don't know. New onset headache. Maybe we should, and that's a different debate with the healthcare system. But I think when we think of kids, at least, that's generally the more common things that right now, we see with celiac in children. A lot of these things are common, but there's people who believe, when the child were exposed, it could irritability could be worse, concentration could be worse, probably very similar to an adult.
I think the migraine thing is a really interesting point because it's as been mentioned, it's very common as an acute reaction to gluten in people who've got celiac disease. I think there was a systematic review sort of 3 or 4 years ago that summarized that people who then with celiac disease who get migraine, who then go on a strict gluten-free diet, it's three-quarters of them find that the diet, either completely or very substantially resolves those headaches as well. And we know that there's undiagnosed rates of celiac disease is still relatively high. So I think this idea of should people who come in with apparently unexplained migraine also be getting a quick test for celiac disease is a fairly kind of compelling argument there. But yeah, it's a question for the medical community there to be looking into a bit more.
Would be another good study to do. It wouldn't be hard to do if we can some of my colleagues put together and just get a good, not large enough sample of everyone who comes in with migraine. Because again, we may see that it's actually, one that we get the same percent as the general population, but I surmise, right, it's possible it's going to be higher. I don't think it's going to be 10 times higher, but it is possible we see, twice the rate. So it's another really interesting discussion. Yeah.
Absolutely.
That's super interesting. I think that we have time for like 1.5 more questions that I'm gonna pull together here. Somebody in the chat asked about the likelihood of, developing neurological problems if you're undiagnosed as a child. They gave an example: if you're diagnosed at 10 and you go on a gluten-free diet, will the severity of the problems decrease as you age into adulthood? So that's question kind of one. And then question point 5 that I have attached to this, Sandra asked ahead of time if a few accidental exposures to gluten would affect neurological health. And I know that you discussed this in your presentation, that, likely the stricter the gluten-free diet, the less problems you might have with this in the future. But I'm wondering if you could just kind of summarize that again as we wrap up here. Yeah, the significance of being on a strict gluten-free diet in alleviating those neurological symptoms.
I'll try and summarize my take on both these things very quickly. The question about, I think when things are being diagnosed in children, everything gets maybe a bit less predictable, but also a bit more optimistic because the brain has more what you call plasticity when you're very young, and we lose this as we get older. So we tend to find that injury sustained to children to do with the brain has a kind of better outlook of recovery than in adults. Um, Generally speaking, if you're having neurological issues to do with gluten, once you go on the diet, you can expect to see some sort of like recovery or like some degree of getting better. And some of that's to do with those acute issues no longer being there that's been talked about. Possibly some of it as well is to do with if you've already sustained some injury, you can kind of learn to work around that in the brain as well. So there's kind of coping mechanisms and things which come up. But I think the thing we're always concerned about is past a certain point, and particularly in adults, the brain does not recover from harm. A brain cell that's died doesn't really tend to regrow. So when you start to see the areas of the brain have shrunk, that's going to be kind of a permanent problem that has to be kind of worked with and around some degree. So it's always a big question about diagnosing people and getting them on the right advice and treatment in as timely way as possible. And that this idea about how much exposure is needed to go on, we're not sure. There's kind of indirect indications from research studies I've come across that, for example, TG6 seems to be a harder antibody to get rid of than TG2, and TG2 is the celiac disease antibody. So I think, but we do also know that going on a strict diet does get rid of TG6. So we know that the diet's the relevant thing for that, but people more readily get rid of TG2 than they do with TG6. So I think the implication is there that a stricter diet is needed. Whether that means that a single cross-contamination exposure in an entire year is going to be enough to mean that you never get rid of it, I'm not sure. That study's not been done, but I think it's a really important one to look into.
The one thing I'll say, and then Dr. will correct me if, again, you feel differently. Obviously, the important thing for everyone to know is, I mean, we haven't followed people for 30 years with celiac disease, right? Generally, people are well controlled. Vast majority of people go on to not have neurological problems.
Yeah.
I think these are research that we've done. These are associations. Clearly, more work needs to be done. If maybe better controls needed, maybe a drug can help with long-term brain health. But I think the important thing to note is those people who do follow a gluten-free diet for decades and decades and decades, these complications that we're talking about are still, pretty uncommon, and the vast majority of people who follow the diet are going to have, normal brain health and have the same risk likely as other people to get neurological consequences as we all get older. But clearly the research that Dr. Croall is doing is incredibly helpful, and we need to just continue to do more of it, follow people prospectively, follow people for a longer period of time to really better answer the question.
I just want to say thank you again to both of you for your time and your expertise. I really, really, really appreciate it. And thank you again to Crunchmaster for sponsoring this town hall. And thanks to everybody who tuned in live and thanks if you're listening later as well. It's wonderful. I hope that everybody has a wonderful rest of your day, regardless of what time zone you're in. Thank you so much.
Thank you.
Thanks, everybody.